Hello, good evening, friends. So today is Sunday and Raksha Bandhan. So a very happy Raksha Bandhan to all of you. Today I am free, and that's why I considered one remedy from our Madravedica to share with you because I have used it number of times in my practice with very successful results. Basically, it, it is a very common remedy in old practitioners or old people's a geriatric remedy. There are many cases to share. I will try my level best to share few cases, out of which first case I want to share. I have used this remedy a way back for the Guillain-Barre syndrome. In fact, it was a case which has developed very fast, a typical ascending paralysis right from the lower extremity. It has developed, and it immediately produced a clear-cut picture of the Guillain-Barre syndrome. So patient started developing the acute troubles in lower extremity, and gradually and patient was on nearly about ventilator in one hospital. So he was on ventilator. I have seen him over there in the ICU, and they were asking, is there any scope of a homeopathic remedy for such type of cases? And the patient was, in fact, otherwise patients rest of the things were normal, nothing was wrong, but he had very much difficulty in taking the mm, breath, and there was typical paralysis of lower extremity. First, there was one more feature which he told me, which the parent relatives told me over there. He started developing this on one day when he explained that he has a heaviness in lower extremities, and it started increasing. And on same day, he complained that he had vertigo while sleeping. And he complained that whenever he was turning in the bed, he had a vertigo. So that was a big clue to the remedy. And when I opened the Borix Matra Medica, the first line itself in Borix Matra Medica explains this aspect of the remedy. So if you read the Borix Matra Medica, always it gives the clue because clinical aspects are quite there. And that's why I will going to explain the Allen's notes only. But first sentence from the Borix Matra Medica, first two sentences from the Borix Matra Medica, which solved this case, is very important, and those are very very essential. So Borix says over there is important. He says an old remedy rendered classical by Plato's graphic description of its employment in death of Socrates. The ascending paralysis it produces, ending in death by failure of respiration, shows the ultimate tendency of many symptoms produced in the proving of for which Conium is an excellent remedy, such as difficult gait, the trembling, the sudden loss of strength while walking, painful stiffness of the legs, etc. So this is very, very, very important that this remedy has a very typical aspect, a neurological aspect, and it never fails. I have used it number of times in Guillain-Barre syndrome thereafter, and it is one of the important remedy one should not forget. There is one more. Vipera is also there, but Vipera has more specific action on the vascular system than on the nervous system. And that's why Conium, I generally think, because it is a very specific remedy for neurologic disorders and typical problems of the brains which develops over there, the gait, the problem at the level of gait, the vertigo, all those things which defines the remedy very clearly. So this is first case which I have treated with the Conium, and I have started him on Conium directly with the 200 potency because it was an acute case. It was not a chronic case. It was an acute case. Susceptibility was quite good, and it developed so fast. So I have started with Conium, and patient recovered within span of a week. The second, third day, his respiration was very good. The ventilator was taken out, and within span of 15 days, he was able to walk very fast recovery happened thereafter with that patient. So this was the interesting case which I have treated with the Conium Maculatum. The second case which I have used was the breast cancer. In fact, nowadays I am using it again and again because there are cancer cases nearly about alternate days. I am getting the cancer cases in my practice, and this is one of the very typical case where I have just observing the breast itself. It defines that this has a very typical hard breast, absolutely hard tumor over there. Already the patient was diagnosed with the CA breast, the partial surgery was done 2 years back, and thereafter they have given the chemo and they declared that you have cured. Even radiotherapy was given, but patient developed it again it within a year, and it was like a hard gut ball. Like it was very typical picture which you can see in even in Hutchinson's book, the picture of a CA cancer. A typical presentation was there. So Conime was the remedy which I have selected because it has typical features. It is very hard specific cancer which is fixed to the chest wall, and it was not so painful. That was another thing of the patient. That otherwise patient was happy, but it was only a big, very hard cancer over there. I have used this remedy for the hard fibroids also. This remedy works wonderfully. One of the patient where which was not which was diagnosed only on the USG sonomammography, and she had multiple nodules and hard fibroadenoma, and she was declared by that sonographist that it might be a neoplastic origin. But after starting the Conium Maculatum, it disappeared within 6 months of treatment. So I have used Conium starting with the 30 and gradually increased up to the 1 mg in that case. So this case also I have started with the 30 and it was responding very nicely, and it started gradually shrinking. So this was very important remedy which I have selected and utilized for the breast cancer, had a successful result. And third important thing for which I have used this remedy was the prostatic enlargement. This is a remedy, old age remedy, which is very useful for the prostate enlargement. And very often I used to consider this remedy if the other symptoms obey. So, generally, the old persons with the benign enlargement of the prostate, with difficulty in voiding the urine associated with the typical vertigo of the conium maculatum, this remedy does the wonder. Generally, it saves the prostatic surgery. So this remedy is very useful in such cases. One important thing which I have noticed in two cases, generally those who are two religious personalities who never marries in their life, this remedy plays a very important role. For two female patients who were having the fibroid uterus, they were not married because of they were the gurus, and there was one clue was there elements from celibacy or suppressed sexual desire, which I have considered in that case, and that itself was a good clue to solve that case. And I have utilized this remedy, and it worked wonderfully, removing the fibroids of the uterus. So this remedy is a very important remedy in your practice. So we'll read it from the Allen's notes. We'll find it out all the details of the remedy. So go with it. Allen's notes, what he says. It is poison hemlock. The family is Umbelliferae. The balm of Gilead for the diseases of the old maids and the women during and after climacteric. First sentence itself suggests that this is a very important remedy, often on use in old personalities. So, geriatric remedy in males as well as in females, specifically the females which are climacteric females or going after climacteric, whatever the pathologies develop, this remedy is a wonderful remedy to be think of, especially for diseases of old men, old maids, old bachelors with rigid muscular fiber, persons with light hair who are easily excited, strong persons of sedentary habits. See, this is another thing. Strong persons of sedentary habits. They are generally not, even though they have a rigid muscle fibers, they are old males, they are weak. Still, it is a remedy for the specifically those who are leading a sedentary life. So they never have a habit of doing hard work. They are not like a field worker's personality, or they are not persons who used to go into gyms. So these are the persons who used to remain over there in front of the computers, in front of just sitting in the chairs, doing nothing. Generally, these old people, after the retirement, they become so indifferent and remains alone. Never wants company. Sometimes they remains alone without doing anything. They are not industrious enough. So Konaim is like that type of personality. Debility of the old people, complaints caused by the blow or fall. It is very close to the arnica. So but if the vertigo develops after blow, think about the conime first. Debility of old people, complaints caused by blow or fall, cancerous and scrofulous persons with enlarged glands and rigid fiber. Underline this is too important. What he says, that cancerous and scrofulous, so there is enlargement of the glands. Specifically, it is a remedy from the cancer miasm, the psychosyphilitic miasm, and very, very, very useful in cancer cases. So, cancers and scrofulous persons with enlarged glands, rigid fibers, muscle fibers are rigid, thick. So that is typical with the psychotic personality. No inclination for business or study. So they don't want to do a business. They becomes indifferent after a certain age. They don't want to do any activity and remains alone. So no inclination for business or study. Indolent. Laziness is very marked with this remedy. Indifferent, takes no interest in anything, and that happens to be there. As if a sepia becomes indifferent, this conime also becomes indifferent. But conime becomes indifferent generally in old age, not in youngsters. Conime's aspect, you'll find such types of personalities off and on in the retired peoples, and you'll find that they were very active before retirement, and after retirement, all of a sudden they becomes indifferent, never takes interest in anything, remains aloof, never wants to read, never have hobbies to do. So such personalities